A fast exhalation is stress. So if we want to tell the brain that we're safe, because the brain will allow us to fall asleep when the brain is interpreting that the body is safe. The brain is here to protect us. But if the brain is interpreting that the body is not safe, we're not going to fall asleep.
Welcome back to another episode of the Peak Performance Life podcast. Today is a very special episode. We have someone that I've been wanting to speak with for a long time, ever since I read his book called The Oxygen Advantage, probably several years ago now, and it had a profound impact on my life. It's something that I think when it comes to health, we don't talk enough about, and it's the most basic, most important thing that I'm going to let Patrick McKeown get into a little bit more today. He is the author of The Oxygen Advantage, as well as many other books on breathing. He is also a clinical director of the Buteyko Clinic International. It's again a breathing thing there, and director of education for oxygenadvantage.com. He's created, in addition to his books, many other training programs. He's worked with athletes as well as regular people who maybe are dealing with illnesses and didn't realize that they could heal themselves by the way that they breathe. So, Patrick, thank you so much for joining us here today.
It's a pleasure. Thanks very much, Taylor.
Yeah, so again, I got introduced to your work back in, I think it was 2015, 2016 with The Oxygen Advantage, a really amazing book. I'd love to start with giving people, because now you really have gone deep and have over the years developed into even more advanced strategies, really incredible things with how people can control their mind better and working with elite people. But let's start with some basics for people with regards to kind of like taking it back to the Oxygen Advantage and some of the basics maybe that people are doing wrong when it comes to breathing that they don't know could be really hurting them.
I suppose there's two real key points when it comes to the breath. Number one is that breathing should be in and out through the nose. Now, it doesn't take a genius to think of that, but at the same time, many people don't actually use their nose. Animals specifically are innate nasal breathers. Babies, when they're born, innate nasal breathers. And with the exception of a couple of animals such as a dog and a few diving birds, the vast majority of animals are actually nose breathers. The cheetah, the racehorse. And I use these examples in the book as well. You think of the fastest animal on earth, and during a sprint, that animal is breathing in and out through its nose. So, Taylor, when it comes to breathing, the mouth does nothing. The mouth has no function whatsoever when it comes to the breath, other than to allow air go straight down the throat into the lungs. So it would have been used by our ancestors in terms of emergency. When they were in a fight or flight response, there was no other way out. They wouldn't have been able to sustain nasal breathing, so they had to revert to mouth breathing. So mouth breathing is for an emergency. And the ironic thing about mouth breathing is that even though 25 to 50% of studied children persistently mouth breathe, and probably about 20% of adults, but we don't have an exact figure, it's not just that we use the mouth during fight or flight, but actually if we breathe through our mouth, it causes faster and upper chest breathing, which in turn is putting us into a greater fight or flight and affecting our sleep. So number one is nose all the way. And number two is the more air you breathe, the less oxygen that gets delivered throughout the body. And I know that flies in the face of what many people think, because we're often told, take a deep breath, take a big breath, and you see this big, big breath of fresh air coming into the lungs. And, I was a mouth breather and I was a heavy breather. I was always tired. I got brain fog. I had poor concentration. I had undiagnosed sleep apnea. I had asthma. I had a stuffy nose. And, this is normal because if your breathing is off, it can affect different functions, and mainly sleep, mental health, and respiratory conditions. So I started practicing. I started doing a nose and blocking exercise. This was back in 1998, and it involved holding my breath to help open up my nose. And then I started breathing light. So in other words, sitting down and deliberately under breathing, taking a really soft breath in through my nose, almost as if the breath in was imperceptible, and having a really relaxed and a slow and a gentle breath out. And if anybody practices it, this is when you're under breathing to the point that you feel air hunger. So gently softening and slowing down your breathing so that you take about 30% less air into your body. And the objective is that you feel slightly breathless. And the slight sensation of breathlessness indicates that carbon dioxide is increased in the blood. And carbon dioxide, as it increases in the blood, dilates your blood vessels and increases oxygen's delivery to the tissues. So with breathing, we've got it all wrong. All of this idea that carbon dioxide is a waste gas, get in as much oxygen as you can, get rid of as much carbon dioxide as you can, without realizing that if you breathe normally, you're almost fully saturated. Your blood is almost fully saturated with oxygen. And part of the equation in terms of your red blood cells releasing oxygen to where it's needed, carbon dioxide is necessary. So where this idea came into being, we have no idea, but it is absolutely a misinformation.
Yeah. So other than when you're in like a full out sprint, if you're running the 100-meter dash or something like that, where maybe you have no choice but to have your mouth open, other than that, ever since I read your book as well, even if I go for a run, I make it a point to keep my mouth closed and breathe through my nose as much as possible. One thing that's interesting though, recently, and I know you just wrote a book about breathing for yoga. In yoga, oftentimes, I find that the teachers will tell you to breathe out through your mouth. Is that so? Is that kind of what do you think about that?
I don't know why they do it. I really don't. I have to figure it out. I think it's, in India it may be different because if you breathe out through your mouth, you can get rid of heat from the body.
Mm-hmm.
But the only problem with breathing out through the mouth is that there's a 42% greater water loss. But breathing out through the mouth during a controlled breath practice may not be too bad. It's when the idea becomes rooted that the way to breathe is in through the nose and out through the mouth. Nobody should be doing it continuously. So breathing out through the mouth with pursed lips to generate a change in pressure in the lungs, that of course may have its benefits, but in a normal everyday setting. And I would say that the yoga instructor doesn't know why they're doing it.
Very interesting. Very interesting. Yeah, we hear this a lot. We hear people say, take a deep breath and sigh. And sometimes it does feel good for a second, to do that sigh. But in the long run, it's not benefiting us. We're actually getting less oxygen.
It's very interesting, because the physiological sigh has become fashionable as well with Dr. Andrew Huberman. And the only thing that I would say with this is I've worked with hundreds of people with panic disorder and anxiety. And it's very common for them to sigh quite frequently. And the reason that they are sighing frequently is that their breathing is uncomfortable, that they feel air hunger. They tell you they can't take a satisfying breath. And in order to alleviate that feeling, they take this full big breath. But the problem with that continuous taking full big breaths is that it keeps them stuck in dysfunctional breathing. So the sigh, it does bring a feeling of relief because you're alleviating that discomfort. But we have to ask, why is there an initial discomfort in the first place? Why is the person feeling that they're not getting enough air? And that's because their breathing isn't up to par. And likely that person is in a greater fight or flight response physiologically. I go into stressful situations. I talk for a living. I go out on stage. I'm an introvert, so it wouldn't have been something that, would have come so natural to me. If I go to a party, half the times I don't want to go anyway. But if I do go to a party, I'll be in the peripheries. I'll be standing on the sidelines talking to one person. That's my idea. I like that one-to-one connection. So if I self-regulate before going out on stage, I absolutely won't be taking these full deep breaths that people do because that will make me lightheaded. That will make me dizzy because all that's doing is causing my blood vessels to constrict. So what I do is I spend maybe 5, 10 or even 20 minutes just down regulating. And sometimes I might even spend just 1 minute, depending on the situation. And all I need to do is take a soft breath in through my nose, which nobody knows that you're even doing, and having a really relaxed and slow, gentle breath out. Again, nobody knows that you're doing. Because if you take a soft breath in through your nose and a really slow and relaxed, gentle breath out, it's the speed of the breath out that your body is telling the brain that you're safe. And the brain in turn then is going to send signals of calm to the body. And I remember having a pretty stressful interview on live. It wasn't live television, but for television, and going out to a large group of people. And just as it happened, I was left for a couple of hours in the production studios, kind of waiting, and you're sitting there in anticipation. And then I was waiting for about 7 minutes purposely kind of left for 7 minutes before the interview. And I could feel my heart rate increasing. And of course, when you start noticing your heart rate increasing, you know that you're going into a little bit of fight or flight response. You don't want to go into fight or flight because your brain is going to protect you and your brain wants you to get out of the situation. So I said to myself, this is what I'm going to do. And instinctively, I just simply took a soft breath in through my nose and a really slow and relaxed, gentle exhalation. I never time it because it's individual to the person. But it was such a gentle breath in and that really slow, relaxed exhalation, because when you breathe out with that slow, relaxed exhalation, whether it's 4 seconds or 5 seconds or 6 or 7 or 8 seconds or 9 or whatever, it has to be comfortable. It's not a forced exhalation. It's a really slow, gentle exhalation. And then another soft breath in and a really slow, relaxed exhalation. You stimulate the vagus nerve. The vagus nerve secretes a neurotransmitter called acetylcholine, which causes the heart rate to slow down, and the brain interprets that everything is okay. And I did that. So I self-regulated, and I walked out into that interview room with a calm state of mind. I put my thinking mind aside. I had my attention on my breath dispersed throughout my body, and I wanted to go out there, and I wanted to talk with every cell of my body. I didn't want the thinking mind to be in the way. And this is a state of mind where we can produce it at will. And I'm only thinking about afterwards, everybody should know this because, from the school child to the teenager, to the corporate, to the athlete, to the family person, to the police officer, stress isn't good because when we get into too much of high stress, we make mistakes. We say the wrong thing, we do the wrong thing. It's really important to be able to self-regulate. I think it's a vital life skill, and even just starting with that. But what's more, the more you can bring breathing practices into your way of life, and it's not about a spectacle. It's understanding that if I breathe this way, I can improve my blood circulation and oxygen delivery, genuinely. Not the nonsense you hear on YouTube. Not the nonsense of taking these full big breaths and oxygen is roaming throughout the body and delivered. That is nonsense. The best way to determine a breathing practice is actually put it into practice. Don't listen to me even. Listen to what I say, but practice it and consider yourself if what I'm saying is correct. Because again, breathing is a little bit like diet. You hear one diet one week and you hear another diet another week, and then you're totally confused and you're saying which is good, which is not good. We have to ask about common sense. How do we breathe when we get into a difficult situation? We breathe faster, we breathe harder, we breathe up our chest, we sigh more, we have our mouth open, our mouth is going dry. There's no natural pauses between breaths. But if we breathe like that during rest, we're also feeding a stress response. And also on the basis of how we breathe during stress, in order to bring our body and mind into relaxation, we need to do the opposite. Instead of breathing faster, we want to slow everything right down. Instead of breathing upper chest, we want to breathe with good recruitment of the diaphragm. Instead of breathing mouth, we want to breathe through the nose, which in turn helps to slow and improve recruitment of the diaphragm. Instead of irregular breathing with sighing and breath holding, we want to achieve regular breathing. And we bring it into our way of life, and it's a tremendous tool because it's always there for us. And it is the ability to be able to self-regulate. It's really important.
It's huge. Yeah, absolutely huge what you're saying. I think also there's the stress aspect of it. That's huge. There's another aspect a lot of people don't realize. A lot of pains, like when I had massive pain 10 years ago in my hands and wrists and arms, and when I actually listened to Dr. John Sarno, and he learned a little bit about the mind-body connection, but he also said something very interesting, that a lot of these pains, even many forms of back pain, shoulder pain, wrist pain, are just a lack of oxygen to the area. And this could be causing some of the pain and things like that. And he says he can't even count how many people have had back surgery when it was just a lack of oxygen maybe to the back. But then it begs the question, okay, well, how do I get more oxygen there? And that is by, breathing the correct way. So I think that's very important.
I think it's really interesting what you just said there about pain. And it reminds me of a paper by Dr. James Bartley. He's an ear, nose and throat doctor from New Zealand. And he wrote a paper on breathing and temporomandibular joint pain. So you can think of the temporomandibular joint, facial pain. And very often when we are in chronic pain, it's a natural response to be anxious because
Mm.
we're not sure where it's going. It's continuously there. And of course, it's going to impact how we feel. There's no doubt about it. But he
Yep.
said the anxiety brought about by the pain will cause us to breathe harder and faster. This is driving up blood pH because it's getting rid of too much carbon dioxide. And the increase to blood pH causes arousal of the central nervous system. So now brain cells and neurons are becoming more excitable.
Mm.
So it's feeding back into the pain. And the other aspect of it is that when we're hyperventilating, and I don't mean an acute setting of hyperventilation, I mean that we're breathing just a little bit faster and a little bit harder. Our blood vessels constrict, there's less oxygen delivered to the tissues, and as a result, the hydrogen ion coming from the tissues doesn't get oxidized. But long story short, it increases lactic acid, and this can in turn be contributing to pain. So, and muscle fatigue. So it's really, that's one of the theories. Now, people might have different theories, and I know there are different theories about lactic acid, but just by looking at his paper, written from a medical point of view, it is natural to hyperventilate, but we don't want to be hyperventilating. If we want to help lower pain, it's very important. Soft breath in and a really slow, gentle breath out. And they have done studies on this, on slow breathing and pain. Yeah, what a wonderful study. They got people, they exposed them to hot temperatures, burnt them a little bit and see how did they respond. And they had them do slow breathing. The people doing the slow breathing had less pain. So I'm glad I wasn't a volunteer with that study anyway, put it that way.
It makes a lot of sense though. I've noticed that as well. Like if I get some sort, something falls on my foot or something, the initial instinct, if you can actually catch yourself very quickly and start to calm your breath and calm yourself, you'll actually blunt, the entire reaction potentially. It's really
Yeah.
incredible. Yeah, it's a
Do
good
you know
point.
what? Do you know what you do first of all, though, when you stub your toe and you're probably letting out a few curses first. But apart from that, normally what we do is we breathe in and we hold our breath for a brief period of time because apparently when the breath in, so when we breathe it in, the diaphragm, of course, is distended and the pain perception is reduced after a breath in, breath in and a breath hold.
Mm.
So it's kind of interesting. And there's another aspect to it as well. Think of a young child in a playground, and the young child trips and fall, and they may cut their knee a little bit. And the child looks down at their knee, they get shocked, and they start breathing a little bit faster and harder, which in turn is naturally going to cause the blood vessels to constrict. So it reduces blood loss. So there's kind of a natural response as well that if we were injured, the stress induced by the injury does actually cause us to breathe harder and faster, which can be helpful in reducing blood loss. But harder and faster breathing is a stress response.
That's very interesting. Very interesting. I do want to go into in a little bit some practical strategies for people to start incorporating a breathing practice in their life. But first, I'd like to ask you, how do people know? We know mouth breathing is a major problem that many people are not even aware of that they're doing, right? So how would someone know if they're a mouth breather? I know you're a big fan of mouth taping at night. Is there, and which is becoming more and more popular? I think since your book, it really became more popular. And now, there are companies selling special types of mouth tape and running ads and all sorts of things like that. And also, any suggestions? Because I'm trying to get my wife to tape her mouth at night, and she's just really afraid. She's like, she doesn't want to do it. I actually told her today, hey, I'll give you some, maybe just practice for an hour during the day or something. Show yourself that you can do it, because I do notice that often she's breathing out through her mouth. It can be common when people take a sip of something, take a drink, and then they're exhaling through their mouth after. And so and now ever since your book, I've been so aware of all this stuff. I'm like, oh no, we can't do that. We got to we got to tape your mouth. And she's like, no, I'm scared. Any advice for people there, and how do they know if they're mouth breathing?
I suppose the awareness is the key. Just
Mm-hmm.
exactly that you spoke. You read a book, and by reading the book, of course, it made you more aware of it because most people are not aware of it. I understand the fear. Breathing is a very individual thing, and any time that we have anxiety or panic or anything like that in our past, our breathing was always affected by it. So then if I'm working with somebody with anxiety and panic disorder, I have to be careful because if I go in too little bit too hard, too fast, it can generate the symptoms because then they can relive the anxiety and panic.
It's a
I
good
do
point.
want to I do want to expose them to it, but I want to do it very gently that they're dipping the toe into the water. Now, we also brought out our own tape, and we brought out a tape ourselves to answer the question. One is, how do we work with children who are mouth breathing? Because for 21 years, I've been working with young kids coming in with their parents. And mouth breathing children, it affects their sleep, their concentration, their respiratory health, and their mental health. Like, for example, ADD and ADHD, that is very much influenced by sleep quality. And sleep quality is influenced by whether the child is snoring or stopping breathing or mouth breathing. And it's well documented. There's 3 million kids in the United States aged between 6 and 21 years of age. Okay, not quite kids. And they have conditions associated with sleep disorders. And very often it gets overlooked. So I created a myotape. Now I'll show you a demonstration because it's a little bit different, but it can also take the fear out. And there's another aspect. There was a study done in conjunction with Harvard whereby they got people with obstructive sleep apnea and they taped across their lips.
Mhm.
And overall it helped the group. But for some of them, I think it was 1/3 of patients, it actually made their sleep apnea worse because it prevented them from mouth puffing. The tape, by taping across the lips, prevented mouth puffing, and when they were not allowed to mouth puff, it worsened their sleep apnea. Now, it was just by chance, because I wasn't aware of mouth puffing. I started doing myotape back in 2019. So I would say you can, if you feel comfortable, listen, there's plenty of tapes out there. But for people who might be a little bit anxious, now this tape is the one for beards, so it's a little bit different, but I'm wearing a beard for those of listening to me. The color is black, but I stretch it about 30%. So it's kinesio tape that's stretched. And it's the
And for those that are
elastication.
listening, those that are listening over podcasts and not watching the video, it's basically a mouth tape, but it has basically like a hole in the middle so that the lips actually could potentially open if they really wanted to.
Yeah, and this takes the fear out of it. So it's the elastic tension that's bringing the lips together, but if you need to mouth breathe, you can. And for sleep apnea, it can allow mouth puffing, but also children, because of course we don't want to cover something right across their lips because of the potential risk there. So that's one way of doing it, but I would say to people, anybody who is listening, if you're waking up with a dry mouth in the morning, it's not a recipe for good quality sleep. You should always wake up with a moist mouth in the morning. And even for dental health, because it's been known, like we all know that saliva helps our teeth. Saliva helps our teeth. It protects our teeth. But if we have the mouth open, our mouth is dry. If our mouth is dry, plaque index is higher. We're more prone to gum disease, dental cavities, and bad breath. So even from a dental health point of view, but more importantly, if you go and look at any studies involving sleep, and if your mouth is open versus when your mouth is closed, when the mouth is open during sleep, our sleep is lighter, and we spend less time in deep sleep, and we spend more time in light sleep. Conversely, when we breathe through our nose, our sleep is deeper. We spend more time in deep sleep and less time in light sleep. And also our snoring index with mouth taped across the board in one study was 47% reduction of snoring by getting the mouth closed during sleep. Like, I would say mental health starts with your sleep, but also your breathing is going to influence your mental health. And the thing about this, Taylor, is that there was a doctor based in Stanford called Dr. Christian Guilleminault who wrote in his latter years of his life, he passed on sadly in 2019, he spoke about the critical importance of restoring nasal breathing, both during wakefulness and sleep. Now, here you have one of the top sleep doctors in the world talking about it. He also talked about children who undergo adenoidectomy and tonsillectomy, which is the gold standard of treatment for sleep disorders. If the children are not taught to breathe through their nose, the outcome is short term. CPAP machine as well is the gold standard for adults. But we also know from a study that if individuals are mouth breathing while wearing the CPAP machine, their compliance rate at 12 months goes down to 30%. In other words, of the 100% of people who were prescribed the CPAP machine, if they are mouth breathers, only 30% are compliant 12 months later. With nose breathing, it's higher. It's 70%. So, yeah, it's no coincidence that mouth taping has taken off. This isn't a fad. This is a realization that if you want a deep sleep, we better have the mouth shut.
Well, what you just showed, I had never seen mouth tape like that before. It basically was, you would almost not think that it's a correct mouth tape because it's taping all around kind of the outside of the lips, but leaving the middle of the lips open. And I want to buy this today because I know that's something my wife would use, knowing that if she really needed to open her mouth. And I think for many people who are afraid of mouth breathing, or they wake up in the middle of the night to go to the bathroom and they want to take a sip of water or something like that, this tape you just showed is phenomenal. I want to buy one today. So this was not a planned advertisement, but where can we buy that what is it called again? Myo tape, was it?
Myotape, yeah. So the website is myotape.com. And I use the name myo because myo means muscle. And also there's a therapy called myofunctional therapy, which is used for alongside orthodontic practices because, again, it was the children coming in with their mouth open. The orthodontist would straighten the child's teeth, but if the child continued mouth breathing, the teeth would get crooked again.
Mm.
So, a relapse and also a mouth breathing child, their shape, the face develops differently than a nose breathing child. And you'll see the chapter. It was quite a controversial chapter when I wrote about it back in 2015. I'm not sure which version. I think it either the USA version or the UK version of the Oxygen Advantage. The publisher didn't want to put the chapter in. So I wrote a chapter about the craniofacial changes that happen as a result of mouth breathing during childhood. Now, I'm one of those kids. I have a nose that's bent and my maxilla, which is my top jaw, is too set back. My mandible is too set back. My airway is compromised. And that brings a host of problems, including poor concentration in school. I wasn't troublesome, but I didn't want to be there, put it that way. But also, in terms of diet, we a connection between diet and sleep. If our sleep is off, our diet is off.
Yeah.
Because if we have poor sleep, it's going to affect hormones, increases ghrelin, reduces leptin. We're stimulating appetite. We're probably more prone to eating junk food, and our mental health is off. If we talk with people with depression and ask them, how do you feel on a day-to-day basis in terms of, are you waking up feeling alert in the morning? We should all wake up feeling absolutely refreshed. I understand it's not always a 7-day-a-week thing, but in the main, our sleep quality has significant potential. When we wake up in the morning, ask ourselves the question, how am I feeling when I wake up this morning? It's huge. So yeah, so the myotape it was part of that solution specifically for kids, but it ended up becoming popular with adults, which is it's great.
So it kind of pushes the lips together to keep them
Mm,
closed just a little bit, but
yes,
if you need to, you
yeah,
can still open them in the middle. Amazing.
yeah, yeah. When I spoke with physical therapists, they said it's stimulating what's a muscle called the orbicularis muscle to help improve the function because, of course, mouth breathing, when we're not using muscles, they tend to become, you know, flaccid, and you kind of know a mouth breathing. Coming back to the publisher, by the way, yeah, that's where I was going. So the publisher said to me, we don't want to publish this chapter. And I says, this is really important. And they said, no, we don't want to publish it. And I said, why? They said, because it will upset the reader. And I said, what about the reader's children? And then they put it, but it's either in the UK version or the USA version. They didn't want to put that chapter into the main body of the book. They put it into the appendix. So we kind of reached,
Wow.
an agreement. So, but now people are talking about it. But that's only 8 years ago. People didn't want to know. Well, it wasn't that they didn't want to know. I think they were just a little bit hesitant or afraid of what might it bring. And there is nothing new about this stuff. This stuff has been talked about, written about in dental journals for 100 years. Mouth breathing children don't do so well, not just in terms of their dental health, their mental health, their academic achievement. You think about the issues such as ADD, it's a big problem, and sleep
Yeah.
is a factor there.
Absolutely. I think this is life-changing stuff. I think someone listening right now, just by focusing on breathing through their nose, by buying the myotape and putting that on at night and making sure that they're not breathing through think about, I mean, if you're sleeping, even 7 hours a night, 8 hours a night, through breathing through your mouth versus breathing through your nose could make just an enormous difference. And then you compound that over weeks and months and years and decades. It's an unbelievable tool that I am certainly, very excited about as well. So, what about people's daily practice? What's a simple kind of people like, okay, so great, what can I implement on a daily basis? What's a practical breathing practice? And then also, there are these extreme breathing practices, right, that people do for maybe a few minutes. What do you think about those, or what do you recommend in terms of a daily breathing practice?
I think the best breathing practice is one that we do and one that's tailored. So if you wake up feeling tired, it's not necessarily about upregulation. It's about conservation of energy. So if you wake up and you're feeling pretty lousy, or if you're tired at 10 o'clock, I would sit down in a nice comfortable chair and put your hands on your lap and close your eyes, bring your attention inwards, and really start slowing down the speed of your breathing. So you're closing your eyes, you're having your attention on your breath, you're taking a soft breath in through your nose and a really slow and relaxed, gentle breath out. And doing that for even 5 minutes, and that will help you to conserve energy and just to feel a little bit more alert. But you don't want then to be too drowsy as a result of it. So then what I would do is maybe go for a walk with the mouth closed, and if it suits you, is do a few breath holds. So I'll tell you my routine. For me to put in a breathing practice, I don't do it formally. I'll tell you what I did this morning. I go onto a cross trainer, and you could use any sort of, anything that you're doing physical exercise with is a great way to start the day. I'm on the cross trainer, I'm breathing in and out through the nose. I'm also conscious of slowing down my breath. So when you're on the cross trainer, your breathing speeds up, but breathe just a little bit slower relative to what you need. And that way then you're going to improve alveolar ventilation. And then a few minutes in, when I'm a little bit warmer, I'll do a few easy breath holds, because this will help to open up the nose and increase blood flow to the brain. I take a normal breath in and out as I'm on the cross trainer, and I'll simply hold my breath. And I might hold my breath for a count of 10. That's all. 10 seconds. 10, 9,
So
8,
you're breathing
7.
in through your nose, then breathing out through your nose, kind of.
Yes.
And so would you almost be like flexing your stomach a little bit to get all the oxygen out of your stomach? You know what I mean?
No, just normal.
No.
Just a normal, yeah. Because if you breathe
Okay.
out too much, it'd be probably a little bit too uncomfortable for you anyway.
Yeah.
So, and this is a great way then to upregulate. So I kind of have there's two ways to do it in the morning. If you're feeling tired, think about slowing down your breathing first to conserve energy, almost like that you're having a mini nap. And then do some physical exercise with breath holds. And don't overdo the breath holds, because if you have a history of panic disorder or anxiety, you have to go gentle, or high blood pressure or any serious medical conditions. You never want to stress the body beyond the point that a good stress becomes a bad stress.
Yeah.
So this morning, I'm on the cross trainer, breathing in and out through my nose. I'm slowing down my breathing. I'm also having my attention on the breath. Of course, the mind wanders, but the way I look at it is, I'm using the cross trainer in the morning. It's only 30 minutes. It's a little bit of training for my physical body, but I'm also having my attention on the breath, so it's training for the brain. But I'm also practicing breathing exercise, so it's training for my breathing. And for me, if I don't do that now till Lord, to be honest with you, a year ago there was so much stuff going on. The practice was, we were busy, and I was feeling, God, I haven't got time to do this because I have so much work to do. And then I was becoming resentful, and I wasn't having the energy that I should have had in my daily practice. So I said, listen, I can't be just giving, we as humans, we can't be just giving our attention out all the time. We have to give ourselves some attention. So my routine is, I have to get this 30 minutes in. So again, nose breathing, tension on my breath, slow breathing. A few minutes in, breathe in through my nose and out through my nose, and simply hold my breath for a count of 10 seconds. Then I continue breathing in and out through the nose for maybe a half a minute to a minute. And then I might hold my breath again for a count of 10 seconds or so. And I'm only counting my head, 10, 9, 8, 7. And then I resume breathing. I'll do a couple of easy ones, and then I'll do a few strong ones, because this helps to open up my airways. So when we do a breath hold like that, it's helping to open up your lungs, it opens up your nose, but it also increases blood flow to the brain. And it makes you more alert. So it's a slight stressor, but it's a controlled stress. Always recover with nose breathing, and always recover with fairly comfortable breathing, even though when you hold your breath, of course, your breath at the end when you resume breathing is going to be a little bit harder, but never push it to the point that you lose control of your breathing. So that's my morning routine. And then maybe afternoon, I've had something to eat. And if I feel that I want to have really focused energy, what I'll do is I have a little 20-minute relaxation that I listen to. Now, by the way, all of these are free. If you go in on YouTube and you put in guided breathing Patrick McKeown for insomnia, there's one for insomnia if you wake up at 2 o'clock in the morning. And I can talk about that because that's one that affects a lot of people. There's one for exam preparation, for athletes, for musicians, for flow states, whatever. So after something to eat, I want to conserve my energy. I want to be activating the rest and digest response. I'll take 20 minutes out and just listen to a guided audio, because sometimes listening to a guided audio is easier because all you have to do is follow the instructions. That's all. You don't have to think about much yourself. And then later on that day, just before sleep, all I'll do is down-regulate, because I want to activate the rest and digest response. Now, you know if you're activating the rest and digest response, you feel sleepy. Digest response, you've got increased watery saliva in the mouth. And I would say if you wanted to give this, if anybody wants to give it a go, you're just sitting there. You might be watching some light television in the evening time. If you are affected by insomnia, I would say use blue light filter glasses, because the blue light coming from the TV isn't ideal. So you're wearing your blue light filter glasses. You're not watching the news or any of this stuff that there's a lot of negativity going on. It's easy watching, yeah? Something that's very easy to watch. Bring your attention inwards and keep it very simple. Soft breath in through the nose and a really slow and relaxed, gentle breath out. And just gently soften your breathing by about 30% to the point that you feel a slight sensation of breathlessness. Now that switches on the relaxation response, and you'll actually start feeling sleepy. And it also switches on the digest response, so check in on the saliva in the mouth. Because we know when we get stressed, how does the mouth go? Mouth goes dry. Not a time for eating food. The last thing the body wants when we're stressed is food. All the body wants when we're stressed is get the hell away from the situation. So we can switch this on and off. Now, coming back then to your question, the extreme techniques. We live in a society that's extreme. The bigger the better. The more the better. And I don't know if we really need to be going that extreme. We need to focus on the basics. We need to focus on the self-regulation of the body by focusing on the breath, by even just doing nose and light and slow breathing, doing physical exercise with your mouth closed, doing your yoga, your dancing, your gardening, whatever you do with your mouth closed. Tremendous breathing exercise. Bringing some of your attention out of your mind and into the body, onto the breath, making your life a life that you're more connected with you and what's going on around you, as opposed to just stuck in your head.
Yeah.
I'm not a fan of the word mindfulness. I'm not a fan of the word meditation. I'm not a fan of the formal practice, because I feel that it doesn't always be accessible to people. It's not just about the 20-minute formal sitting. It's really about what can you do with these tools that you can bring them into your way of life, that they become a habit, because then it sticks. And then, there's a comfort in knowing that you have something. So anyway, the more extreme practices will involve hyperventilation, maybe for 20 breaths or 30 breaths, followed by an exhale hold to the point that your blood oxygen saturation can go quite low. And then you might do another 30 hyperventilation, exhale hold, and they are definitely stressor exercises. People have got great benefit out of them. They have. But I would say is that we have to be careful with the exercises that we do, that we tailor them to them. And I say if you want to go with the more extreme, don't start with extreme. Start with dipping your toe into the water. Instead of hyperventilating for 30 breaths, maybe hyperventilate. Full big breath in, a full big breath out, and a full big breath in, a full big breath out. Try it for 5 breaths. And then exhale and hold until you feel a moderate air hunger. And listen to how your body responds, because I'll tell you this straight off. From working with individuals, I've made plenty of mistakes. And I've made mistakes knowing I didn't make them intentionally, of course, but it was because I was working in that capacity with people. that I could see firsthand whether something was working or something wasn't working. If I went a little bit too hard with some of the exercise, I generated anxiety, or I generated a panic disorder for a person, or I caused them that their heart rate elevated and they felt very uncomfortable. But I had that ability because I was working with hundreds of people every year for many, many years. And as a result, then it just made me realize breathing is a very personal thing. We can't just put out a breathing technique that's one for all. And I'll tell you, I went one step further because back in 2002, nobody really wants to know much about breathing. And it wasn't yoga breathing. This isn't yoga breathing. It's not the breathing practices that are typically taught in the Western world for the last 40 years. No, this was your everyday breathing. This was your breathing to improve blood flow and oxygen delivery. That was often the opposite that was commonly taught in the yoga studio. And that's another conversation, because what was originally taught in yoga in the formation back maybe 2,500 years ago, right up to 1880, is different to what's being taught today. So how did I get my information out there? I started writing books, and I wrote a book called Close Your Mouth back in 2003 because I figured $15. You have all of the information in the book, and people will take a chance with $15. And the book was a way of getting the breathing techniques into the hands of the people. Last year, we developed an app, which is completely free, and everything inside it is free. We spent $150,000 on the app. Now, if I knew I was going to spend $150,000, I wouldn't have even started it. Let's be honest with you. I thought it was 30,000. And then the more we went in, the more ideas came. And before we knew it, we totally lost control of it. And final product, 150. People say it has to be subscription. I says, no, I don't feel comfortable. I want this app to get out. It's about awareness. It's about generating awareness. Now, the app was 100 different breathing exercise sequences with about 30 different types of individuals. So you put in, I've got high blood pressure. My Bolt score, which is a measurement of your breathing. It's just your breath hold time. And what it will do then is it will give you a breathing exercise in the morning for you, the afternoon for you, and the evening for you. Or if you have sleep apnea, or if you're a child. And that's gave me a sense that, yes, we have all of this information. It's no good just me having it. Let's put it out there. And there are the more extreme exercises are there for athletes, because sometimes the athletes love them. But I'd also say it's really important for the athletes to get the basics right. So start off with the basics and take it from there.
Amazing. What's the name of the app?
Oh, it's the same name as the book, Oxygen Advantage.
Oxygen Advantage. People can download that for free and have 100 different guided practices. Amazing.
Yes, and no subscription. Everything in it for free.
Amazing. Thank you for doing that. That's really incredible. Let's talk about sleep a little bit, right? Sleep is a big hot topic these days. Yet I haven't heard many people talk about a specific breathing practice or something like that. And I think I've heard tons of podcast episodes about sleep, and you hear different strategies and keep the temperature cool and wear blue light blocking glasses. We've heard all that. But you have, obviously, a great thing for someone to do who's having sleep problems would be to listen to your guided sleep, breathing or breathing meditation, whatever we call it. But yeah, talk a little bit about what is some tips and strategies in terms of breathing to help improve sleep and sleep quality.
Sleep quality, how you breathe during sleep is influenced by how you breathe during the day. If you're going around mouth breathing during the day, you will be breathing faster, harder, more upper chest breathing. This is tipping you into a fight or flight response. So you're more sympathetically driven. You're more in that fight or flight response. And if we then bring that breathing practice into our sleep, our breathing doesn't automatically correct itself during sleep. If we've got poor breathing during the day, we're naturally going to have poor breathing during sleep. And 50% of the population wake up with a dry mouth in the morning. That's in my experience, the adult population. And it gets worse as it gets older. I'll give you this example. Snoring. Let's start with snoring. So there's mouth snoring, and it goes like this.
Wow. Yeah.
And now if you close your mouth and try and snore with your mouth closed through your mouth. Try and snore through your mouth now with your mouth closed. Mouth snoring stops once you get the mouth closed.
Right.
Simple as that.
Right.
So there's the solution with that one. But I'd say don't just rely on mouth taping. Bring nasal breathing into your everyday life so that you're comfortable breathing through the nose. And if your nose is a little bit stuffy, you can do gentle breath holds to help free it up. So the wonderful thing about the nose is that the more you breathe through it, the better it works. The second snoring is nasal snoring, and it goes a little bit like this. And if you learn then to soften and slow down your breathing, this changes your breathing pattern so that your breathing is lighter and your breathing is slower. And with lighter and slower breathing, there's less resistance to your breathing in the upper airways, which is including the space in the nose and where the nose meets the throat and the throat itself. So you can significantly reduce nasal snoring by improving your everyday breathing patterns. Now if we go one step further, and I wrote a paper on this, a review article that's peer-reviewed with 2 ear, nose and throat doctors, looking at our breathing during the day and how it is related to our sleep apnea during sleep. Because sleep apnea is a big problem. It affects between 25 to 50% of men and about 10 to maybe 30% of females. We want to be breathing in and out through the nose with the tongue resting in the roof of the mouth. We want to have light and slow breathing driven by the diaphragm because that helps to reduce the risk of sleep apnea. It's not just the size of the airway. You know, modern medicine looks at sleep apnea and they say it's all about the anatomy, even though that kind of stance has changed now. It's not all about the anatomy. It's not all about the size of the airway. Of course, the size of the airway, if it's narrow, it's a problem because the airway is more liable to collapse. But airway size is one thing, but breathing flow, the speed and depth at which you breathe is another thing. And we have influence over both because if we breathe through the nose with tongue resting in the roof of the mouth, we can have the open airway size. If we breathe through the nose with good recruitment of the diaphragm, it increases lung volume and the throat is stiffer and less likely to collapse. If we breathe light and slow and low, this in turn is reducing the pressure, the negative pressure associated with breathing or the turbulence in the airways. So the third aspect then is insomnia. You know, we're on mobile phones all day long, 2 to 3 hours scrolling through nonsense, filling our heads full of information that's absolutely useless. We never get a point or a time to switch off. I am 50 years of age, I've plenty of grey hairs, but you know what? I had 30 years without a mobile phone. And if I was bored as a kid, I'm standing at a bus stop. Yeah, I'm bored. I have to look around and it's time out. Or if I'm sitting on the bus, maybe I'm reading a book. But if I get bored, I'm looking out the window and I'm just going into the state of boredom. I had plenty of opportunities to be bored. Nowadays, nobody has an opportunity to be bored. They're stimulated with their school and with their work. But then when there's a downtime, they open their pocket almost immediately. It's almost like a drug. They don't even know they're doing it. They're picking the phone out of the pocket and they're scrolling aimlessly because of the dopamine hit. But the brain isn't getting it's not getting any sort of break. So there's an overstimulation that's happening, that's going on throughout the day. And yet we are expected to be able to switch off for sleep. No, we have to give our minds a rest. And especially the last couple of hours during sleep, we have to go very, very easy with the information that's coming into us. I think the down regulation is really, really important. You know, telling your body and for your body to tell the brain that it's time for you to go into rest response. And you can do that through the breath because it's through the breath. We can tell the brain if we're stressed. Like if I start saying now, breathe hard and fast, in and out, in and out, in and out, in and out, your brain will automatically interpret that you're stressed. And of course, your brain then is going to launch into this fight or flight response, and your body, etc., is going to follow suit. But if we want to tell the brain that we are absolutely safe, just take that soft breath in through the nose and that really relaxed and slow, gentle breath out. And it's the speed of the exhalation that counts. It's not the speed of the inhalation. Whenever we get into a difficult situation, it's typically, if we go into stress mode, it's typically followed with a fast exhalation. A fast exhalation is stress. So if we want to tell the brain that we're safe, because the brain will allow us to fall asleep when the brain is interpreting that the body is safe. The brain is here to protect us. But if the brain is interpreting that the body is not safe, we're not going to fall asleep.
Mm-hmm.
And overstimulation of the mind. We go to sleep, we're lying there, 10 o'clock, 11 o'clock, we're still lying there, the thinking mind is switched on, we're twisting and turning, the bedclothes are all over the place, and eventually we fall asleep. That's overstimulation. And that is definitely influenced by a stress response. Any of us can experience that. If we've had a bad day or there's a lot of pressure on, it's a very natural thing, you know, that the mind can be ruminating. And even though we can train it to a fair degree, I don't think it is, well, I'll only talk in my own personal situation. I would have some degree of control over my thinking. It's something that I've practiced for many, many years. But I know that if there's a really difficult day, it can be pretty challenging to quieten the mind. Or, for example, if we wake up at 2 o'clock in the morning, and that's another time that insomnia can manifest. And this is the more challenging time because we're after having a few hours of sleep. But at 2 o'clock in the morning, it's almost as if we're in limbo. We're not quite awake enough to get up, but
Right.
we're not quite tired enough to fall back asleep. And at 2 o'clock in the morning, then, for a while, I was practicing my own breathing, slowing down my breathing, slowing it down, slowing it down. Yeah, I could fall asleep, but it wasn't always guaranteed. So that's where I said, okay, an audio. So if I was to wake up at 2 o'clock or 3 o'clock, I came in from Los Angeles last week, jet lag all over the place. And it takes normally 1 day for every hour of a time zone. So we've got 8 hours of a difference there. So we're talking about 8 days. So 2 o'clock, wake up. Okay, how am I going to fall asleep? My mobile phone is on flight mode. But I do reach over. I just go to downloads and I hit the recording and I just listen to it. And it's almost as if I'm passing the task on to somebody else. Because if I'm lying there myself trying to self-regulate during sleep, it's more difficult to do than during wakefulness. But if I just lie there, and if I just have a passive attitude and I don't care what happens, and I'm just handing it over to something else, I allow the recording to put me to sleep, and it works. So there's different strategies that are pretty cheap, well, in actual fact, that's free, that are helpful.
Yeah, that's very helpful. And I think it's a much better alternative. Number one, I think the idea of not bringing your phone into the bedroom with you is a big one. And then the other thing is if you wake up at 2 in the morning, you know, if you're turning back on the TV or looking at your phone at that time, then it's going to be really hard to get back to sleep. You know, you're just hitting yourself with blue light at that time. So I think this is just it's a great solution. I have one last question for you. I know we have to wrap soon, but just with regards to nose breathing also, it's also important, I've heard, to breathe kind of like expanding your stomach when you breathe rather than kind of breathing into your chest, right?
It's much better to breathe low than it is to breathe high.
Yeah.
If we think of the main breathing muscle as the diaphragm, which is separating the chest from the abdomen.
Mm-hmm.
Now, ordinarily, when we're taking a breath, a message is sent from the brain to the diaphragm breathing muscle, and the diaphragm breathing muscle moves down during rest by about 2 to 3 centimeters. Now, as it moves downwards, we will have movement to our sides, a little movement to our back, and a little movement to our front. So,
Mm-hmm.
people talk about belly breathing, and I know that's the words that are often used, but sometimes I feel that a person could confuse it, that they could be pushing and pulling their belly in and out irrespective of their breathing. What I like to typically do when I'm working with my clients is, yes, it's really important to breathe low because your diaphragm is not just for respiration, but it's also connected with the emotions. So there is a mind-body connection there, but also the diaphragm breathing muscle is providing stabilization for the spine. We know that 50% of people with lower back pain have dysfunctional breathing. And dysfunctional breathing from a biomechanical point of view indicates that they are more likely to breathe upper chest. Now, you could ask the question, is it the lower back pain which is causing upper chest breathing, or is it the upper chest breathing which is reducing stabilization of the spine, which is feeding into lower back pain? It could be bidirectional. Sometimes there's a feedback there. So if you have your hands either side of your lower ribs, and you're breathing in and out through your nose, and as you breathe in, that you're just gently feeling the ribs moving out. And as you breathe out, that you're feeling your ribs moving in. So this is a deep breath in the true sense of the word, because a deep breath just means far from the top, like a swimming pool. You know where the deep end is, and you know where the shallow end is. So shallow, you're not so far from the top, but deep, you're a little bit further from the top because it's recruitment of the diaphragm. So deep breathing or low breathing is really, really important because of the mind-body connection, the gas exchange that takes place, and also movement of the diaphragm is massaging our internal organs. So you can think of the stomach. Every time we take a breath, it's massaging everything there. It's enhancing lymph drainage because the lymph system doesn't have its own pump. So it's relying on the actions of the diaphragm. And also venous return to the heart is increased with diaphragmatic breathing. And I think the stress component again, because stress feeds into everything. Stress feeds into inflammation. And inflammation, of course, is not ideal. So yeah, nose, low and slow. But we go one step further. We go nose, light, slow and deep. So an easy way to remember it is light, L, slow is S, and deep is D, LSD.
There you go. Nice. I love it. Great information here today. And I really want to commend you as well for the app. I mean, you could have easily charged, $100, a year or whatever people are charging for apps that have less stuff than what is in your app. So I'm definitely going to download right after this, the Oxygen Advantage app. I am definitely going to go to Myotape and purchase some of the mouth tape that has a little open hole in the middle. So anyone who's been afraid of using mouth tape, like my wife, will now be able to use this mouth tape and experience all of the benefits of it. And where else can people find you, and follow you, learn from you?
If you read books, Amazon, we have all our books on Amazon. Just put in my name, Patrick McKeown. The websites have good resources. Oxygen Advantage is kind of mental and physical performance, and Buteyko Clinic then is for asthma and for sleep apnea and for panic disorder. I think the app is a good place to start. It's free. And Myotape there is a product. So, you can really bring breathing into your way of life, and it's pretty accessible. And that's ultimately what it's about, Talur. It's really about communicating breathing in a language that's appealable to the person, because I feel that for decades, breathing has been around for a long time. Why hasn't it been taken up? It wasn't communicated and it wasn't made accessible in the right way. I feel there has been a loss there.
Well, thank you for filling that void. The Oxygen Advantage book is, I think, up there as one of the most important health books, in my opinion. Highly encourage everyone to get that, and really commend you again for not just, going for a money grab. You're really putting out a lot of information to help people. We can tell that you're genuinely interested in helping people, and, really, really appreciate that. So, Patrick, this has been an absolute pleasure, and I hope we can do it again sometime soon.
Absolutely. Thanks very much, Talur.
Thank you. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic, vegan, and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.